Anxiety disorders are perpetrators of worry that jumble up thoughts within the mind. I personally have dealt with anxiety disorders all my life under the name of one specific disorder. Its name is generalized anxiety disorder. It affects my academic life, my personal life. In the future, it could very well affect my professional life and career as a whole. Good morning. My name is Giovanni Charas, and today I'll be discussing to what extent has the prevalence of anxiety in adults affected their productivity and social skills within the workplace. Now, anxiety is a normal thought, but anxiety disorders become prevalent when that anxiety becomes a constant obstacle in everyday life. According to the Anxiety and Depression Association of America, 40 million adults are affected by anxiety disorders. These anxiety disorders then affect management skills and motivation, which then harms productivity, as well as harming skills and perceptions related to social abilities. Productivity, as explained by Richard Nixon in his Labor Day address, really means getting more out of your work. Richard Nixon explains the 4 productivity elements as investment in technology, job training, good management, and high employee motivation. Anxiety affects these 2, motivation and management. Management is using your resources and time wisely, while motivation is being concentrated and focused while willing to get the job done. The Chartered Institute of Personnel and Development, a nonprofit organization focused on improving workplace practices, conducted a mental health survey in the UK. 85 out of the 2,000 participants claimed to have mental health disorders, including anxiety. How did this poor mental health affect them, their productivity in the workplace, was a question that the CIPD asked them. Responses related to management are shown by the blue arrows: difficulty managing time and difficulty multitasking, while green shows motivation-related ones, lack of concentration, and occasionally procrastination. Flexibility, a subtopic of management, is also affected because of anxiety. According to senior editor of the Atlantic magazine, Derek Thompson, routine is not available to the unemployed. Being employed does supply a daily routine, but quick impacts on this routine can harm the person because their flexibility is not as strong as someone without anxiety disorders. In red, those are the detrimental effects that respondents had regarding flexibility. Those being having difficulty in making decisions and learning new tasks. These unknowns are what is harmed by anxiety, and productivity isn't the only thing affected. Social skills are increasing in the workforce, as found by peer research. From 1980 to 2016, employment in jobs requiring stronger social skills increased from 49 million to 90 million, or 83%. That is way more than physical skills and 6% more than analytical skills. In the CIPD survey, respondents claimed to have less patience with customers and clients, and also getting more into conflict more often with colleagues. This connects with the social skills of relationship building and customer service within the workforce. Perceptions are also something that take a hit. Generalized anxiety disorder causes the individual to be more irritable and tense when dealing with others. Others oftentimes see this individual as cold and unfriendly, but outer perceptions aren't what anxiety disorders feed off of. Inner perceptions are the poisons of the mind when it comes to anxiety. 4 professors at McGill University conducted a study on interpersonal perceptions using social phobia. Community controls without anxiety disorder were compared to those with the social phobia. The study found that the individuals with social anxiety disorder reported higher embarrassment, more feelings of inferiority, and more self-consciousness when talking face-to-face. This caused them to be less outgoing because of their fear of themselves. The sad part is, anxiety disorders aren't even final. There are solutions, such as medication, psychodynamic therapy, and cognitive behavioral therapy. First is medications. SSRIs and SNRIs are considered the best within this group. They are considered effective, yes, but they don't always have a 100% success rate. A personal experience I had was an SSRI named fluoxetine. This past summer, I had been given it to try it out, and it didn't work as well. Rather, it caused my anxiety to flare up more, rather than actually help it. As I said, it doesn't have a 100% success rate, and I'm one of those that it didn't help. The next one is psychodynamic therapy. Psychotherapist Boren Bandelow recommended this therapy as a fallback to cognitive behavioral therapy. While it does clear the anxiety from the roots of the mind, implication is length. This therapy takes about 2 years to see any long-term effects and changes within the mind. The best solution is cognitive behavioral therapy. According to the Anxiety and Depression Association of America, it focuses on identifying, understanding, and changing thinking and behavioral patterns within the mind, and it typically takes 12 to 16 weeks or 3 to 4 months. Of course, this could be another implication if the patient wants results quick. A bigger implication is what makes this therapy so effective: participation. If the participant refuses to participate or doesn't want to be helped, this therapy is rendered ineffective because then they don't learn the necessary skills to combating anxiety. Anxiety needs to be taken out of the workforce because these disorders are coming in contact with the increasing social skills within the workforce. Anxiety is more than just a thought. Thank you. Questions?
All right, I do have 2 questions for you. First up, how did you select the strategies that you used to gather the information, and were the different strategies effective? Which were effective?
I started out by going to certain sources that overviewed the topic, such as the Anxiety and Depression Association of America and the National Institute of Mental Health. And I looked at the broad overviews of what anxiety does to everyone and how many people in America are affected by these. Then I used those to go on over to source finders such as EBSCO to research into specific studies done, such as the one I mentioned about McGill University, where they had done an interpersonal perception study.
Which one of those did you find was effective, more effective?
I found the Anxiety and Depression Association really effective because it gave a broad overview about every single thing. There were misconceptions involved, which I would have included, but due to time constraints, I wasn't able to include them.
Okay. And then my last question for you. Explain the level of certainty you have about your solution to this problem.
Cognitive behavioral therapy, my level of certainty is I'm pretty sure this one is the best one because a lot of the documents that I was searching through, such as the one Boren Bandelow, this had been a study in Germany where they found the best solutions for different anxiety disorders, and every anxiety disorder was listed under this cognitive behavioral therapy as effective. While psychodynamic therapy, the best one would be social phobia, but it wouldn't always work for generalized anxiety disorder or panic disorder.
Is this anything you want to try personally?
I'd have to look into it more because I'm still unsure after the medication had failed.
All right, cool, thanks.